My name is Alaba Ogunbajo, a 100 level healthcare management student of JPTS Institute of Management and Science and Technology in collaboration with South American University USA, Global Wealth University Togo, and American College California, etc. I will be presenting a brief seminar paper on the themes: the presence of hepatitis B envelope antibody in patients who have been previously screened for the surface antigen. What do you mean by hepatitis B? Hepatitis B is a serious infection that affects the livers. How can we contact this infection? Number one, by semen, by blood, and by fluid. We can easily contact it. One, the semen is by sex. The blood by using the needle, unprotected needle. Then number three, the fluid, that is the sweat and other disease that comes out from the body. You can easily contact it. Then another thing is, people ask that how can hepatitis B be cured? No, in my research I discovered that hepatitis B cannot be cured but can be prevented through the vaccination of the disease. And how can organizations that handle that is CDC, that is the Center Disease for Control, that handle that. So for taking the vaccines, we protect you from this infection. Then what are the implications for someone that has been infected? Number one, it can lead to liver cancer. At the same time, when you have a liver cancer, you know that that person is getting to the grave. So then other thing people used to ask the doctors and the nurses is that how like someone that have it, like how many years can someone be living? That person, such victims can live for 50 years plus before the symptoms can come up or appear. So to my advice for people is that whenever anytime you are having the symptoms, those symptoms like swelling of the leg, abdominal pain, jaundice, like eyes, redness of the eyes, then like having feverish and all that, you need to consult your doctor for further test to confirm maybe is the infection. So another thing is that other thing about hepatitis B is that sometimes you don't feel the symptoms on time, because it takes long time before you can feel the symptoms. So but you have to go to your doctor. Make sure that you do check up all the time, so that you'll be able to know how your body system, your liver, how it functions, how it works well, so that you will not be one of the victims of this hepatitis B. So in my conclusion is that I will advise everyone that you should, anytime you feel those symptoms I mentioned above, you should please go to your doctors for complaints and for further investigation about your body system. Thank you.